Thanks very much for having me. It's a real pleasure to come and talk to you about the findings from this study. My name is Ella Guest. I'm a research fellow at the Centre for Appearance Research in Bristol, and I carried out this research with my colleagues Maya Thornton and Nicholas Stock. This was funded by the Psoriasis Association. And throughout this, we have some illustrations accompanying my slides, which were developed by an illustration student at the university who was looking at the impact of skin conditions. And I think she captures people's experiences really well. So it's nice to have those to accompany the slides. So to start with, what was the aim of our research? Well, we wanted to explore the impact of flare-ups on psychological well-being, treatment adherence, and life engagement in adults with psoriasis. And we had this funding received as part of the Cecil King Memorial Grant in 2018. So we did collect the data before the pandemic. So I think, it's possible that we may have had some additional findings if we'd collected it later. And it was in line with research priority 10, which is what's the best way to treat sudden flare-ups of psoriasis. So obviously, rather than looking at particular treatments, we were looking at this from the angle of understanding people's experiences of treating their psoriasis and trying to prevent flare-ups and how this impacted how well they could manage. So the study, I guess a bit of background, why did we carry out this study? Well, I'm guessing a lot of people here may feel this themselves, that people can have a real lack of control over their condition and find it difficult to prevent flare-ups and manage their condition. And although there's been research into flare-ups and managing psoriasis, not much of it has looked at patients' own experiences of living with psoriasis and given them sort of research from their own voice. And if we can understand lived experiences, people's individual needs, and also the nuances and differences in between different people and how they cope and manage their condition, this could be really helpful to give us some more detail to help inform clinical practice and support. So before we carried out the research, we got ethical approval from our university Research Ethics Committee. Then I carried out 18 telephone interviews with some adult members of the Psoriasis Association who kindly agreed to speak to me about their experiences in quite long interviews. Some of them lasted around an hour. And I asked them about their experiences of living with psoriasis, their flare-ups, their experiences with health professionals, how they managed their condition, and also focused on how it impacted their lives overall. And then we used something called thematic analysis, which is a qualitative analysis technique to look at common themes across the data. So essentially, we were able to identify the common experiences of the adults. So I'll tell you, I haven't got very long, so I'm going to give you a bit of a whistle-stop tour. But one finding that we identified, which is slightly on the side of the general findings, is that some of the adults didn't feel that the term flare-up really related to them. They didn't identify with the term flare-up. And this was often because people felt that their symptoms fluctuated quite slowly and they felt flare-up was more of a sudden worsening, or they found that their condition progressively worsened over time. And actually there weren't periods where the psoriasis got better. So this is quite important, and I guess I'll talk a bit more about this at the end. But in terms of our general findings, we identified three main themes relating to living with psoriasis, managing psoriasis, and learning to cope. And I'll quickly go through all of those and give a bit of information. So to start with, the first theme, living with psoriasis, all of the adults told us about the physical symptoms of having psoriasis and flare-ups, but they also felt that psoriasis had a really big impact on their psychological well-being, their lifestyle, and their interpersonal relationships, and that this was actually really important and big impact of living with psoriasis. So in terms of psychological well-being, experiencing and managing flare-ups really impacted some people's mood. In some cases, it also affected their mental health. People discussed anxiety and depression in relation to having psoriasis and the impact of having to manage it. And also, a lot of people reported feeling self-conscious about the appearance of their psoriasis, particularly during a flare-up where it was more noticeable, and this affected their self-confidence and made them feel sometimes like they had to cover their skin, although other people had talked about becoming more accepting of this and feeling a lot less self-conscious. And interestingly, as well as having psoriasis impacting people's emotional well-being and mood, they felt that their well-being actually directed their psoriasis too. So, for example, stressful events were often thought to have triggered the onset of psoriasis, and people felt that these that certain stressful events led to flare-ups too. And this was seen as particularly difficult because, as we all know, it's really difficult to avoid stressful events in life. They are a part of things we have to deal with. And this made people feel a real lack of control over their condition, which was seen as quite difficult and distressing in some cases. Now, moving on to the impact on their lifestyle. During a flare-up, lots of the participants avoided certain activities because they felt self-conscious about the appearance of their skin. And this included things like going swimming or playing certain sports where they might have to wear clothes that showed their skin. And perhaps, say, when it was warm weather, they felt like they were often covering up their psoriasis, which was really kind of uncomfortable, particularly when it's warmer. And again, they also found that lifestyle factors had an impact on their psoriasis. So things like diet and the weather, but this really varied between the participants and it seemed to be a very individual thing. And then the last impact in this theme was interpersonal relationships. And here people's experiences really varied. So some people felt that their friends and family and colleagues were really good support in terms of practical and emotional support, but others felt that they didn't really discuss it. Maybe it was a bit of an elephant in the room, or they worried about being asking for too much support from other people. And there was also a theme in relation to romantic relationships. Having psoriasis could affect people's ability to form romantic relationships, particularly if they felt quite self-conscious. And in some cases, it could physically impact their romantic relationships if they were having flare-ups and they were affected by symptoms. So that's a really important consideration, I think. And as well as people that the participants in the study, the adults with psoriasis, knew, there was a lot of experiences with others that they didn't know. So things like negative encounters with members of the public, people staring or asking unwanted questions, misconceptions, people asking if psoriasis is contagious. And there was a general feeling that this was down to a lack of awareness. Lots of people don't know what psoriasis is. But on a more positive note, some people felt that this was changing because of things like the Psoriasis Association and people being able to use social media to raise awareness and educate the general population. So now moving on to the second theme, which is about managing psoriasis. This involved two sub-themes, which was one about self-management and the other one was more about the treatment pathway that the adults had been involved with. So in terms of the self-management, the adults often found that their treatment regime was quite impractical and difficult to adhere to. Treatments might be quite unpleasant or messy or quite time-consuming, potentially very difficult to fit around their other aspects of their lives if they were working or if they had caring responsibilities. And they also had some concerns about psoriasis, which influenced their decision about what treatment to use and whether to adhere to it. In terms of the treatment pathway, it was really interestingly, the participants in the study felt that their experiences with health professionals really influenced how able they felt to control their flare-ups. There was quite a strong consensus that GPs don't have as much knowledge as is necessary to treat psoriasis because they haven't had that specialist training. And this could make it really hard for people to manage their flare-ups because they were being given particular advice whilst they were waiting to see a dermatologist, which could be for waiting quite a long period of time, and they weren't getting the treatment that they felt they needed. Another really important one, or I suppose particularly of interest to me as someone who's a trainee psychologist, is that they felt that the wider impact of psoriasis on things like their quality of life, their well-being, wasn't always considered. It was treated more as a physical condition, and they would like that to have been addressed. And they also felt that as treatments for psoriasis are not necessarily don't work for everybody. There was a sort of trial and error approach where they would try different treatments over a period of time and find one that worked, but this left them feeling that they were had periods where they couldn't control their psoriasis. And finally, the last theme, learning to cope. This involves healthcare and positive adjustment. So in terms of healthcare, feeling able to cope with flare-ups was related to receiving prompt diagnosis and also seeing a doctor that understood that psoriasis is more than a skin condition and the wider impact it can have, and feeling listened to. That was really important and involved with their treatment decision-making so they could find something that was effective but fit around the practical aspects of their lives. And positively, I suppose, ending on a really nice note, quite a lot of the participants felt that they had been able to find a balance between effective treatment and sort of living their lives and having a good quality of life. And some felt that they'd learned to accept that psoriasis was just part of their identity, and felt that having psoriasis had made them more empathetic and understanding and helped them to support other people. So just to wrap up, what can we do with these findings? Well, we can explore whether people relate to the term flare-up and if there might be other language that's more accessible that would be better to use. I think it would also be useful to work with patients to develop more training with GPs in terms of what they would like them to know, and, for example, some of the wider impacts on their mental health and their appearance concerns, and where GPs can signpost patients to for more support. Perhaps promoting the use of decision-making tools which are used in other areas of healthcare to encourage shared decision-making. And something we do a lot at the centre I work at, developing and evaluating population-level campaigns to reduce stigma relating to psoriasis and other conditions that affect appearance. So I'd just like to say thank you so much to the Psoriasis Association for funding this research and advertising the study, and a massive thank you to the 18 adults who gave up their time to talk to me. We couldn't have done this research without them, so thank you very much. And this is some information about Rasheen, who is the illustrator whose images I used. So hopefully I haven't gone too over time, but thanks for listening.